How to care for a rescued dog. Rescue dogs require a little more time and patience than a non-rescue dogs. They often have behavioral and physical problems from their previous life. Make sure your home and family members are ready to welcome the dog into your home. Treat your new addition with respect and a calm demeanor. Develop a routine early on so your dog feels secure and safe with you. Method 1. Preparing your home. Dog-proof the house. Making your house safe for your dog will save you a lot of stress when you bring him home. Move household chemicals out of your dog's reach. Protect your furniture with a throw or slipcover if your dog will be sitting on it. Look for any long cords, tassels, or dangling items that may be attractive to your dog. If you have a yard, make sure that your fence is secure. Your dog should not be able to jump over it or dig underneath it to get away. Gather your supplies. Purchase a crate, baby gates, bedding, water bowls, food bowls, flea comb, 20-foot, 6.1 meters, leash, food, toys, and grooming supplies. When you go to pick up your dog, take his buckle collar, ID tag, leash, and a harness, collar with you. These supplies can be purchased from your local pet store. It is important that you get these supplies before you bring your dog into your home. You want to start out on the right foot. The earlier you can establish consistency, the better. Establish house rules. If you live with other people, sit down and discuss the house rules for the dog. Where will the dog's crate, bed, and bowls be? What will the dog's schedule be like? Also, remind everyone to be calm and inviting when meeting the dog for the first time. Avoid hugging, kissing, or patting the dog on top of its head. Discuss how the dog will be introduced to each member of the household. The dog should only meet one person at a time. Learn about his past. Try to find out as much as you can about your dog's previous life. This will help you deal with any behavioral or medical issues your dog may have. Some questions you should ask are: was the dog abused? How did the dog end up at the shelter? Has the staff noticed any behavioral problems? How is his health? Method 2. Building trust. Give him space. Your dog will need time to adjust to his new environment. Keep him restricted to roaming just 1 or 2 rooms for the first few days, while you stay close by to supervise. This will help him from feeling too overwhelmed by his new surroundings. As you start to open up the whole house to him, he'll want to examine and smell everything. Take him on a tour of the house while his leash is still on and allow him to take in his new environment. Your dog may pant, pace, have an upset stomach, or chew or drink more than usual at first. This is completely normal. He is just excited and nervous. Be patient. Depending on his past, your dog may be shy and has not been house-trained or socialized. Because of this, your dog may be afraid of new things or engage in unpleasant behaviors like eating his own feces or marking his territory. Pay attention to how your dog responds and adjust your behavior. For example, if you are trying to teach a new command and your dog becomes tense or starts looking out of the corner of his eye, you need to give your dog some space and stop what you are doing. Dogs like to run away when they are scared. Keep the crate door open so your dog can always retreat when he feels overwhelmed. Be firm, but kind. Do not punish your dog for misbehaving at first. Your dog will not make the connection between punishment and bad behavior. Instead, your dog will be scared of you. If your dog misbehaves, stop the behavior and then give your dog a treat for stopping. For example, if your dog is biting shoes or trying to pee in the wrong area, tell your dog, "No, don't do that," in a firm voice. Once your dog stops, give him a treat and give him some praise. Introduce noises gradually. Do not yell or make loud, sudden noises around your dog. You do not want to scare him. Use a soothing tone anytime you are speaking to or around your dog. Introduce new noises like the television or vacuum slowly. Try to keep the house quiet for the first couple of weeks. For example, after a couple of weeks, you may start watching TV when the dog is in the room. Once the dog is used to the TV, you may vacuum around him. Always judge his reaction. If he looks scared, reassure him that everything is fine and allow him to retreat into his crate. Make sure that everyone else in the home keeps it relatively quiet as well. Recognize signs of separation anxiety. Living in a new environment often triggers separation anxiety. Your dog may become anxious when you leave him home alone and act out. Dogs typically do not do these behaviors in front of their owner. Common signs of separation anxiety include urinating and defecating when you leave him alone, barking, crying, or howling when left alone, destroying objects, e.g. door frames, doors, household items, when left alone, trying to escape from a confined area, eating feces when left alone, pacing in straight line or in a circular motion. Deal with separation anxiety. Do not spend all of your time around your dog when you first bring him home. If you are home all day, go to another room for 5 to 10 minutes to give your dog space. Try to vary your routine, leaving at different times in the morning or at night, so that your dog doesn't get upset when he anticipates your departure. Give your dog a treat or a toy when you leave so that he associates your absence with something positive. Have brief absences before you leave your dog home alone while you are at work. Start with 5 to 10 minute absences and build up to 40 minutes. Most of your dog's anxious behavior happens in the first 40 minutes he is alone. If the anxiety is not getting any better, talk to your veterinarian about your dog's behavior. Let him sleep around others. Your dog should sleep in the same room as you or other housemates. This helps your dog understand that he is a member of the group. Your dog should have his own bed or sleep in his crate. Make sure your dog can see you from where he is sleeping. Do not allow your dog to sleep in the bed with you. Your dog may take this as a sign that he is in charge. Method 3. Developing a routine. Feed him twice a day. Keep your dog on the same feeding schedule for the first few days. He probably ate once or twice a day at the shelter. Maintaining the schedule will keep your dog from getting diarrhea due to a new regimen. If he was only eating once a day, you can begin to transition him to eating twice a day. Divide his meal into 2 and give him the majority of his food during his first meal. Gradually increase the amount of food he gets at the second meal until he is eating twice a day. If possible, feed him the same food he was given at the shelter and slowly transition into the food of your choice. If your dog was living in shelter, he may have had to fight to make sure he got something to eat. This can result in him being territorial about food. If you notice that your dog is barking or lunging when you get too close to his food, feed him in a crate or a bathroom. Eventually your dog will learn that he does not need to guard his food. Potty train your dog. Take your dog outside to use the bathroom first thing in the morning, 1 hour after a meal, as soon as you get home from work, and right before bedtime. Praise your dog when he uses the bathroom. If your dog has an accident or pees in the wrong place, do not punish him. This will only teach him to fear you. If you will not be around to take your dog to the bathroom, keep him in his crate. Dogs will usually not use the bathroom in their home. Try to take your dog to the bathroom at the same times each day. This will help him develop a routine and feel secure. Exercise regularly. Your dog will need to have at least 1 exercise session each day, but the amount and duration of exercise will depend on his individual needs. Pay attention to your dog's preferences as well. Some dogs may be happy with a walk while other dogs may want more intense activities like running or playing fetch. If your dog is breathing heavily and no longer wants to participate in the activity you are doing, it is time to end the exercise session. For example, if you were playing with a stick and he no longer wants to bring the stick back, take a break. Establish care with a veterinarian. Your dog should visit a veterinarian within the first week that you bring him home. Your vet will do a general checkup, discuss preventive health care, and determine any special needs that your dog may have. Try to have the visit scheduled before you bring your dog home. Consider buying pet insurance to help with the costs of care. Don't forget like and subscribe my channel and click on bell button for more videos.